In this lesson, we will be explaining how to properly remove a dog from a floor-level cage to restrain for lateral saphenous venipuncture. Removing a dog from a floor-level cage to restrain for lateral saphenous venipuncture is properly removing a dog from the cage that they are in, restraining that dog laterally on their side, and then preparing that dog for lateral saphenous venipuncture or blood draw in their back leg. And this is used for blood draw or IV catheter placement. The person who would be removing the dog and restraining them for venipuncture would be a vet assistant in a vet clinic, and then the vet technician or the veterinarian would perform the actual lateral saphenous venipuncture. Step 1 of the practicum is the student places a leash in one hand with a large loop open in the correct position in the P and ready to place over the dog's head. Step 2, while blocking the opening, the student opens the cage door enough to slip the hand holding the leash into the cage. Step 3, the student slips the leash over the neck of the dog and gently tightens the leash around the neck. Step 4, the student opens the door and allows the dog to exit. Step 5, the student lifts the dog and places them on the table. Step 6, the student places his or her right arm across the dog's neck and reaches between the front legs to grasp the dog's right forelimb in their right hand. Step 7, the student places their left arm over the dog's back and reaches for the dog's right rear limb, just proximal to the hock. On the slide here, you can see us define properly some of these terms that you will be utilizing in the practicum. The term proximal refers to the nearest to the center of the body or the point of attachment. The hock is properly pictured in the picture. So the term proximal to the hock means the point closest to the hock. Step 8. With the dog's body close, the student gently lifts the limbs while holding the dog's body to lay on the table. The dog should be on their right side. Step 9. The student allows the dog to relax for a couple of seconds, not releasing the grasp on their limbs. Step 10. The student uses their left hand to hold the limb tightly in the area just distal to the stifle, which will occlude the vein. The term distal refers to farthest from the reference point. So distal to the stifle would be farthest point from the stifle. In this slide, you can see for the lateral saphenous vein location. The picture on the left shows a blood draw being done with the person's hand in the correct position occluding off that vein and their finger running along the side of the vein, so that way the vet or the vet technician can see which way that vein is traveling. When you hear the terms lateral versus medial, it's important to note the difference in location. Notice if you have the dog laying on their side, their lateral saphenous vein would be the rear limb on the opposite side of which they are laying on, and on the top of the dog, or the part of the dog that's kind of reaching for the sky, versus the medial would be on the inside of the leg.
Today I'm going to properly demonstrate how to remove a dog from a floor-level kennel into lateral saphenous venipuncture. To start, I'm going to place a leash in one hand with a large loop open and ready in the P to place over the dog's neck. While blocking the opening, I'm going to place my hand in with the loop into the kennel. I'm going to place the leash over the neck of the dog and gently tighten the leash around the neck. I'm going to open the door and allow the dog to exit the kennel. I am then going to place my dog onto the table. I'm going to place my right arm over the dog's neck and reach between the front limbs to grasp the dog's right forelimb in my right hand. I'm going to place my left arm over the dog's back and reach for the dog's right rear forelimb just proximal to the hock. With the dog's body close to mine, I'm going to gently lift the limbs, allowing the dog's body to lay on the table. The dog should be on his right side. I'm going to allow the dog to relax for a couple seconds, not releasing my grasp on the limbs. I'm going to use my left hand to hold the limb tightly in the area just distal to the stifle, which will occlude the vein.
So in summary, to restrain a dog for cephalic venipuncture, one must place a leash in one hand with a large loop open in the correct position and ready to place over the dog's head. While blocking the opening, open the cage door enough to slip the hand holding the leash into the cage. Slip the leash over the neck of the dog and gently tighten the leash around the neck. Open the door and allow the dog to exit the cage. Lift the dog and place the dog on the table. Place your right arm across the dog's neck and reach between the front legs to grasp the dog's right forelimb in your right hand. Place your left arm over the dog's back and reach for the dog's right rear limb just proximal to the hock. With the dog's body close, gently lift the limbs while allowing the dog's body to lay on the table. The dog should be on the right side. Allow the dog to relax a couple of seconds, not releasing the grasp on the limbs, and then using your left hand to hold the limb tightly in the area just distal to the stifle, occlude the vein. And that is how to properly restrain a dog for lateral saphenous venipuncture.